Hello, I'm Dr. John Balbus, a physician and an environmental health professional. Healthcare providers are trusted sources of information on drinking water quality. But how much do you know about how the water flowing from your patient's taps can affect their health? Doctors, nurses, and other healthcare providers are in the front lines of recognizing, reporting, and perhaps most importantly, preventing waterborne illness. In this video, we tell the stories of 3 communities that have been affected by drinking water quality. These case histories help demonstrate actions you can take in your own practice to prevent illnesses related to your patient's tap water. After watching this video, you will be able to do the following. Name 4 health problems related to contaminants in drinking water. Identify the types of patients who are most sensitive to each of these health problems. Describe how the contaminants that cause these health problems enter drinking water supplies. Identify the treatment methods that remove the contaminants that cause these health problems. List the clinical findings that should prompt reporting your suspicion of a waterborne disease to the local health department. Describe how patients who receive water from public water systems or private wells can learn about their drinking water quality. Describe the role of healthcare providers in a public health network that identifies and responds to waterborne illness in their community. List 3 resources to find further information on drinking water and health.
Part 1. Drinking water contamination and treatment with Milwaukee case study. On the night of August 31, 1854, the Soho district of England suffered what Dr. John Snow described as the most terrible outbreak of cholera which ever occurred in the kingdom. Prior study had convinced Dr. Snow that cholera was spread by water, and he identified a single pump on Broad Street as the likely source of the contaminated water in this outbreak. His extensive interviews with families of the Soho victims revealed that even deaths that appeared unrelated to the Broad Street pump water could be in fact traced directly to it. By the time Snow was able to convince local health officials that he was right, over 600 Soho residents had died from the contaminated drinking water. Eventually, Dr. Snow's hypothesis concerning the relationship between water contamination and disease was accepted. Research by Snow and others has shown that water can be contaminated by many different types of microorganisms, causing serious diseases if water is not properly treated. By the early 1900s, U.S. cities had begun treating their drinking water for harmful microorganisms in the water to reduce associated diseases. Today, water treatment plants work to avoid another Soho-like epidemic of waterborne disease. Specific treatment technologies vary from plant to plant, but the basic elements of the treatment process have not changed much since it was first developed. The treatment process often begins with coagulation, which causes the particles in the water to clump together and form larger particles. Then, as the water moves slowly through the system, the large particles sink to the bottom of the holding tank. Usually, the resulting effluent flows through a filter of anthracite or activated carbon, sand, and gravel, or a combination. As the water flows through the filter, most of the pathogens and other particles are removed. After the water is filtered, it is disinfected, usually with chlorine or chloramines, to kill or inactivate the remaining pathogens and prevent their growth in the distribution system. The treated water is then stored in a closed tank or reservoir, ready to pump out to the community. The water treatment process works remarkably well. The vast majority of Americans are well protected from outbreaks of waterborne disease. But as we shall see, some risk of exposure to waterborne pathogens remains. Under the authority of the Safe Drinking Water Act, EPA has set legal limits for more than 90 chemical, radiological, and microbial contaminants in drinking water. The regulated chemicals are a small fraction of those potentially contaminating water, but represent the best-known chemical threats to health from drinking water. The work of healthcare providers in combating waterborne illnesses is compounded by the myriad sources that can be responsible for problems. Toxic chemicals can enter sources of drinking water by a variety of mechanisms. Some chemicals, such as pesticides and fertilizers, enter drinking water sources after being deliberately applied to the land, or sometimes ponds and streams, and subsequently washing into surface or groundwaters. The most serious contamination is likely to result from accidental chemical spills or application of inappropriately large amounts of chemicals. Other chemicals enter drinking water sources after improper disposal of wastes, such as cadmium or other heavy metals leaching from old hazardous waste sites, or through leakage from storage tanks, such as gasoline products and additives. Some toxicants occur naturally in the Earth's crust and can enter groundwater that is in contact with deposits of these substances. When groundwater comes into contact with these deposits, it can pick up traces of these substances. Some of these chemicals have little or no recognized effect on people who regularly drink the water, but affect newcomers and infants. For example, drinking water high in sulfates can result in a mild laxative effect in newcomers or travelers, and more severe diarrhea in infants. Other naturally occurring chemicals, such as arsenic and radon, can increase the risk of cancer when consumed at high levels in drinking water over long periods of time. Arsenic and other chemicals are more likely to contaminate drinking water sources in areas where mining, pesticide use, and munitions manufacturing are taking place. Finally, some chemicals such as lead and disinfection byproducts may be present in our water supplies due to our treatment and distribution methods. Corrosion of materials containing lead and lead solder in the distribution system and plumbing of homes and other buildings, and some older water coolers can result in lead in tap water. Also, some older pumps in private wells contain lead parts. Disinfectants can react with naturally occurring materials in the water to form unintended byproducts which may pose health risks. Disinfection byproducts are formed when small organic molecules dissolved in the water react with added chlorine and in some cases bromine ions which already are present in the water. The organic compounds come primarily from decayed vegetation and dead microorganisms. This complex mixture has been associated with a variety of health outcomes and epidemiologic studies. The strongest evidence exists for an association between trihalomethanes, which are one class of disinfection byproducts, and cancer of the bladder and colon. While scientific evidence is not conclusive, some studies have also associated adverse reproductive outcomes, such as miscarriage, with exposure to high levels of trihalomethanes. EPA has strengthened the standards for disinfectants and disinfection byproducts in drinking water. The most common types of microbial pathogens found in water are bacteria, viruses, and protozoa. In general, bacteria are more effectively controlled than viral or protozoal pathogens by existing water treatment processes such as filtration and chemical treatment. Most bacteria are removed by conventional filtration or killed by chlorine treatment. Viral pathogens have been shown to play an important role in waterborne gastrointestinal diseases. The causes of most waterborne disease outbreaks are unknown. However, it is believed that most waterborne disease outbreaks with no identified cause are in fact caused by viruses. Viruses' small size and mobility enable them to contaminate both surface and groundwater sources. While most virus particles will adhere to organic material in water and be removed through filtration, enough may evade the water treatment process in cases of heavy contamination of other conditions to cause human disease. Unlike bacteria, many types of viruses are resistant to chlorine disinfection. Since the 1970s, the most commonly identified organisms causing waterborne disease outbreaks have been protozoan pathogens, including Giardia lamblia and Cryptosporidium parvum. Protozoan pathogens have a complex life cycle in which the infectious form for humans is a tiny encapsulated cyst or oocyst. These forms are very hardy in the environment. They can survive for a long period in water or soil, and they may be resistant to chemical disinfection. It is this hardiness and the fact that only a small number of cysts or oocysts can lead to infection that make protozoa more difficult to control through standard water treatment techniques than most other pathogens. In general, people with compromised immune systems, such as AIDS patients and patients undergoing radiation treatment or chemotherapy for cancer or organ transplants, are most at risk of severe disease and death from waterborne microbial infections, whether from bacteria, viruses, or protozoa. Cryptosporidiosis has a devastating impact on AIDS patients and other immunocompromised people,
causing chronic diarrhea, hepatobiliary disease, and death.
Infants may also be at risk for several reasons. Their small size and circulating blood volume allow them to reach critical levels of dehydration more rapidly than adults. In addition, infants have had fewer prior exposures, so their immune systems may not respond as rapidly as older children and adults to certain infections. Infants also drink more than adults in proportion to their body weight. The elderly may be at risk as well, due to a tendency to become more severely dehydrated and the possibility of declining immune function. This explains why the cases reported to public health agencies are the tip of the iceberg, or in this case, the top of an inverted pyramid. After a widespread population exposure to an infectious agent, as occurred in Milwaukee, only a small proportion becomes ill. Many have an asymptomatic infection. Of those who become ill, only a few are sick enough or feel the need to consult a physician. Of those consulting a physician, very few will have the required tests, such as acid-fast testing, performed to establish the infectious cause of acute diarrhea. Of those who do have those tests done and return positive results, only a fraction eventually get reported. Studies have been conducted to estimate the proportions of cases at each step of the pyramid for foodborne but not waterborne illnesses. It is estimated that only 5% of acute foodborne illnesses are recognized and reported. For waterborne illness, this percentage may even be lower.
Of course, every patient with diarrhea can't have laboratory testing done, but healthcare providers are on the front line in recognition of waterborne and foodborne disease. How can the clinician improve our ability to recognize common source outbreaks? First, include questions about water sources and practices in the standard history taken for patients with diarrhea. Patients who recently drank from an untreated well or other inadequately treated source would deserve additional investigation. Second, take stool samples more frequently and be sure your laboratory performs tests for the appropriate waterborne or foodborne pathogens. For example, in most laboratories, stool samples sent for a standard ova and parasite preparation would not automatically be tested for Cryptosporidium. An acid-fast or fluorescent test for Cryptosporidium must be ordered specifically. It was, in fact, protozoan pathogens that were responsible for one of the most widespread and deadly outbreaks of waterborne disease in modern America.
In the spring of 1993, Milwaukee, Wisconsin experienced the largest outbreak of waterborne illness caused by the protozoan Cryptosporidium ever reported in the United States.
On Monday, April 5th, 1993, I received a phone call from our chief virologist inquiring to see if I knew about any disease going around the community. The water department was getting a lot of calls, customer complaints about taste, odor. My water tastes funny, it's discolored. Those were going to our environmental health section. At the same time, our laboratory is getting inquiries from the media wondering about, what's going on, what are the viruses circulating in the community, why are all the antidiarrheals off the shelves.
The thing that was unusual and that really caused the pieces to fall together with the very first case is that there was diarrhea going around that we did not have a germ for. We knew that it had to be some type of an infectious agent, and the kind of things you don't see germs for, people were thinking viral types of illnesses where it's much more difficult to find, yet no electron microscopic studies were able to identify anything.
When we plotted out the illness and began to look more closely at who was getting sick and where they lived and kind of opportunities for infection, we began to see clusters on the south side, and that helped us sort of narrow in to, in fact, water distributed by the south side plant.
Finally, a patient presented herself. She was in her early 70s, and her physician had admitted her for the same symptomology. And he was doggedly thorough.
Her only problem was that she had rheumatoid arthritis, so she was compromised, but she was not compromised in any way that I would have thought that she would have been at risk for getting Cryptosporidium as we knew it at that time.
He asked our laboratory to test her stool for everything under the sun, and not just the routine open parasite testing or the usual enteric pathogens. And one of the microbiologists said one morning, "You're not going to believe this, but I found Cryptosporidium in the stool specimen.
We found it in somebody who should not have had it. Probably could be a good culprit for the other cases that are going around.
Because of that, my lab staff went ahead and on their own cultured all the stools that they had submitted that particular day for Cryptosporidium. Out of the 7 stools that they tested, 5 out of the 7 were also positive for Cryptosporidium.
I think there was a general feeling of disbelief that water quality or contaminated water would be an issue in this community given the technology employed at the water treatment plant, given how modern that technology is, how widespread the water is distributed.
It became clearer that drinking water was the problem and that the South Side Howard Drive plant was the source of that problem. There was a clear understanding in the health community that action should be taken to alert and protect the public. Members of the health department met with the mayor to discuss strategy.
Mayor Norquist turned to our state epidemiologist, Dr. Jeff Davis, and noticed he was drinking a soda and said to Dr. Davis, are you comfortable drinking the water in this community? And Dr. Davis said, no, I'm not. And with that little bit of evidence and just the feeling of the public health staff around the table, a boil water advisory was issued that evening.
The Boil Water Advisory was of particular importance to that part of the population with weak immune systems, such as people with HIV or AIDS, chemotherapy patients, organ transplant recipients, infants, and the elderly.
It was clear that there was a large crisis, a large outbreak of cryptosporidiosis affecting many, many thousands of people, and we instantly knew that our patients were at risk for some very serious illness, because we knew that cryptosporidia was an illness you recover from if you have a normal immune system, but it's very difficult to recover from if your immune system was compromised. And we began to find our AIDS patients who had developed cryptosporidiosis, and that began a period of about 6 months of handling many patients with cryptosporidiosis, which was a very difficult experience and a very bad memory.
A couple important lessons that we learned here in Milwaukee. Number one is that our disease surveillance systems that were in place were inadequate to detect this outbreak. By the time we got our first calls on that Monday morning on April 5th, there were probably 250,000 people who were infected and sick in our community already. And so really our investigation started at the tail end of the outbreak. Certainly as a result of this outbreak, we've learned for the need for better communication with our water utility.
We also meet monthly to talk about water quality issues and anything that people see on the horizon or feel is worth bringing up. And I think that the whole community disease surveillance program has been strengthened as well. And we are able to respond to any kind of indication that something has happened rather quickly. And I think that's a good thing.
Well, of course, the magnitude of this outbreak caused us to rethink top to bottom all that we did. There's been work that's been done with the CDC. There's been great science and research on cryptosporidiosis subsequently. I mean, there's been things from improving the filter beds, more monitoring, more surveillance, active surveillance, the relationship between the health department and the labs and the hospitals in this community were strengthened probably forever.
And I think healthcare providers in any community should develop a relationship with their local health department as well as their water utility, so they understand very clearly what the source of water is in their community, how it's being treated, and how it's being monitored. And then conversely, how the health department is involved in the monitoring or disease surveillance. And I think both of those areas can be tremendous resources to the private physician, clinic or hospital.
I think we've developed that piece of communication that maybe wasn't there prior to the epidemic. And they did develop a task force, and people, different levels of the community were on that task force, and I think they continue to respond to that.
What we've really learned is that things that we think are esoteric pathogens, not very common pathogens, maybe really are common pathogens, and we don't find them just because we don't look.
Our role in this whole scenario of identifying infectious diseases and their relationship to the threat that it may pose to public health is that we are the people who do kind of what's referred to as shoe leather epidemiology. We're the guys, the detectives who are out there questioning why is this happening and trying to put clues together and providing those clues when appropriate to other people who have power and authority to investigate further.
On April 14th, the mayor held a press conference to announce that water samples were free of cryptosporidium and that the boil water advisory had been lifted.
It's really a normal reaction for people not to want to consider that something as widespread and common as their water supply could possibly be such a major risk to everyone, because it's scary and it's bad publicity, and no one wants to fathom that that could be the reason. It has to be something else.
I think it's important that when an epidemic of waterborne illness is identified in the community, that all the forces be brought to bear to publicize this among both the population at risk and the healthcare community, the treating community.
Outbreaks like the one in Milwaukee demonstrate why it's so hard to recognize outbreaks of waterborne disease. The symptoms can't be distinguished from diarrheal diseases transmitted by other routes. It requires alert clinicians and the proper testing of specimens.
EPA has strengthened protection from microbial illness under the authority of the Safe Drinking Water Act. New regulations are expected to prevent further outbreaks and substantially lower rates of endemic cryptosporidiosis. A higher baseline level of this illness exists in sensitive subpopulations. Part 2, Lead Contamination and Philadelphia Case Study.
Modern water treatment technologies and management and regulatory programs have profoundly decreased the incidence of waterborne illnesses in America. However, outbreaks of waterborne illnesses still appear periodically. Some outbreaks, like the outbreak of cryptosporidiosis in Milwaukee, are due to microbes that may persist in inadequately treated water, while others are due to contamination of springs, streams, or wells that have been thought to be safe sources of untreated water. Another source of waterborne disease that is getting increased recognition is chemical contamination. In 1998, a Philadelphia, Pennsylvania school principal raised a question about safe drinking water in her school. The ensuing investigation revealed a widespread problem, and the city took prompt action to resolve it.
Most people associate lead exposure with paint chips and dust, or prior to unleaded gasoline, air pollution. Nevertheless, drinking water may contribute up to 20% of the background exposure to lead in the general population and up to 40 to 60% in formula-fed infants, according to EPA estimates. Like many other contaminants, high levels of lead are associated with more severe health effects in children and infants. In Philadelphia, a large percentage of children have high blood lead levels. When very high levels of lead were found in school and daycare drinking water fountains, EPA acted to eliminate this additional source.
We initially received a complaint from a principal in a school. She'd had bottled water in the school for a number of years. However, she was new to the specific school and wanted to know, whether the water was safe. During the same time period, we received a complaint from an additional school, and we started to broaden the questions to the school district about how many schools have been sampled, what they'd found in the early 90s. And that ended up leading to detailed discussions with the school district, the health department, the state of Pennsylvania, and our office to determine the extent of lead in the school district.
One of our partners in the project is the Philadelphia Water Department. They conduct regular tests for lead and other contaminants in their water, and they're in full compliance with the levels that EPA sets for water systems. Lead leaches into the water in the plumbing within homes or schools or any building from lead solder, from brass fixtures, and fluxes and a lot of other plumbing components that contain brass or lead. Once it's in the building is where the lead gets added. That's why we tested every single outlet, because we weren't sure which outlets were good and which outlets were bad. You really can't tell by looking at them that this water fountain's going to be good and this sink is going to be bad, just by visual inspections. You have to actually test the water.
And what they found in Philadelphia's schools surprised them.
We found over 25% of the drinking water outlets that were sampled contained lead above 20 parts per billion, which is the action level for schools and buildings.
Lead in drinking water is regulated by a treatment technique that requires water utilities to control the corrosiveness of their water. If more than 10% of tap water samples throughout the service area exceed 15 parts per billion, water systems must take additional steps. So that schools and other institutions can address individual problems, EPA recommends, but does not require, that action be taken if a specific faucet exceeds 20 parts per billion.
If a child's taking lead in with the water, it may not be the primary source, but it's still a source of increased lead levels in the child. And some children take in enough, particularly in cases where parents prefer formulas and leaded pots and things of that nature, that they're actually lead poisoned directly by the water exposure. But every bit of lead exposure that a child gets is damaging.
We are certainly concerned about long-term effects, many of them which are very subtle, but affect the child in terms of their neurologic development, their ability to think, their ability to perform in school. And so elevated blood lead levels and lead exposure has been associated with learning disorders, problems with attention, problems with behavior, some decrement in a child's intelligence.
We've issued a consent order to the school district and reached an agreement with them with regard to testing all of the drinking water sources in the schools. And this has resulted in roughly 18,000 outlets total being tested. We found some over 1,000 parts per billion that could have caused some very serious damage just on a very limited exposure. So we're really very happy about the outcome of the program. We think it's a great success.
We worked with the health department and the school district to develop some information that we sent home with all of the children about what was going on in the project, that all of the unsafe drinking water outlets were turned off, or if they hadn't been tested yet, they were turned off because we just didn't know yet.
In cases where the school district didn't have enough uncontaminated outlets to do this, they've provided bottled water for the students in those schools.
The press, they get involved, so other schools around the area, around the Philadelphia area, both in the city that weren't public schools or outside the city, became interested.
Other schools did get involved, including the Roman Catholic Archdiocese of Philadelphia, which is voluntarily testing the water in its 240 elementary schools and approximately 30 high schools. So what started out as one principal's concern for her school ended up with a massive testing and remediation program in schools throughout the Philadelphia region. The investigation of the schools leaves us with several lessons to be learned.
The age of the building doesn't seem to matter for lead testing. We had no correlation between the age of building and the outlets that tested above the action level of 20 parts per billion. So the bottom line is that you don't know by looking at an outlet if it's new or old whether it's going to have high lead. So we really are encouraging people to test any outlets in schools or daycare centers where they think there's a concern.
Well, I think our concern for healthcare providers is to make sure that they're looking for the symptoms of lead poisoning, making sure they recognize what those symptoms are, making sure that they're getting infants tested for lead, and then if it's identified that they need to include water in the equation of whether or not it could be contributing to the lead.
What's true of Philadelphia's schools is also true of your patients' homes. Very old and poorly maintained homes may be more likely to have lead pipes, joints, and solder. But brand new homes are not immune. Even brass and other alloy fixtures that are legally lead-free may contain as much as 8% lead. Depending on how they were manufactured, these lead-free fixtures can leach significant amounts of lead into the water flowing through them for the first several months after their installation. Health professionals should not ignore the more common sources of lead poisoning, which are lead paints and contaminated dusts in the home, especially those built prior to 1978.
Part 3, Household Wells, Alternatives for Immunocompromised Patients, and Minnesota Case Study.
people of this tri-county region of Minnesota get all their drinking water from the local groundwater supply. The problem? Nearly 15% of the wells in this region are near or over the drinking water standard for nitrates. And even though most naturally occurring bacteria and other microorganisms generally don't affect the quality of groundwater, some wells may use groundwater that is in close contact with surface water contaminated by microbial pathogens. Modern water treatment technologies and management and regulatory programs have profoundly decreased the incidence of waterborne illnesses in America's cities and towns. That still leaves a large rural population whose drinking water comes from private wells that can on occasion become contaminated. Local boards of health in Brown, Nicollet, and Cottonwood counties, Minnesota, have taken steps to address the problem.
In the mid-1980s in this area, a small baby died. The doctors who diagnosed her condition decided it was probably a combination of a congenital condition and formula made with contaminated water. Her family went on to question locally what was going on with the groundwater, and the townships in the Midwest have now started taking a look at the extent of contamination and some of the sources.
The concerns that we have in regard to water supplies here in our area is that in Brown County we have a lot of families that live out in the rural area. And some of those rural farms have old wells, some even have hand-dug wells. Some are located next to fields, next to animal feedlots, confinement buildings, those kinds of things. Not always do we know what the quality of water is. The program that we have regarding water safety and water quality involves a public health nurse actually going into the home and making home visits.
While I'm here today, Natalie, I thought what might be a good time to test your water. We have free water testing.
Talking to parents about the water source, if they're on a private water supply, why they should have their water tested, and the dangers of coliform bacteria or high nitrates to infants and children and pregnant women.
Fecal coliform and E. coli indicate that water may be contaminated with human or animal wastes. While most strains of E. coli are harmless, and some are even necessary to our intestinal function, the particular strain E. coli 0157H7 has been known to cause severe illness. Contaminated well water is thought to have resulted in outbreaks of this bacteria in Alpine, Wyoming in 1998, Washington County, New York in 1999, and Walkerton, Ontario in 2000. In the Ontario outbreak, 7 people died and more than 2,000 became ill. In New York State, nearly 500 became ill and a young girl died.
E. coli is a problem because it can cause acute diarrheas, intestinal problems that are, of course, dangerous for the elderly and the very young and the immunocompromised, such as people undergoing chemo or with HIV. But they can also lead to hemolytic uremic syndrome in young infants or children under 5 years old, which can be fatal. So we really want people to test.
Another problem in the water is nitrates and high nitrates, and that happens when there is some type of contamination, either from animal waste or nitrates that are added to fertilizer or to the fields, or other vegetation that disintegrates and causes an increase in nitrates in the water table. This can cause things like blue baby syndrome.
Blue baby syndrome, or methemoglobinemia, is a condition caused by excessive exposure to nitrates. Nitrates in drinking water are converted to nitrites by intestinal bacteria. Nitrites, once absorbed into the bloodstream, oxidize hemoglobin in red blood cells, forming methemoglobin. Methemoglobin is unable to transport oxygen and conveys a very dark blue-brown color to the blood. Infants, particularly those less than 2 months, lack the hemoglobin reductase enzyme needed to reduce methemoglobin back to its functional form. While rare, infant deaths from severe methemoglobinemia have been reported to be associated with consumption of nitrate-contaminated drinking water.
Nitrate ions can enter drinking water sources through runoff from fertilizer use, leaching from septic systems, sewage and erosion of natural deposits. The EPA has estimated that nitrates can be found in 52% of community water wells and 57% of private water wells in the U.S. These figures are all the more serious when you consider that infants are especially threatened by illness due to nitrates in drinking water.
The infants most at risk for blue baby syndrome are those who are already sick, and while they are sick, consume food that is high in nitrates or drink water or formula mixed with water that is high in nitrates.
With either coliform bacteria or nitrates, is a lot of times it doesn't change the quality of the water, the taste or the smell of the water. There are a lot of other things that happen that can be contained in well water that can cause it to look rusty or to smell funny. Those things, for the most part, aren't threatening to health. These are things that maybe go unseen that can be a threat to health. So it takes an education process to try to convince parents that this can influence their health, even though the water smells good and tastes good.
When we first began testing, we heard some interesting stories about where people thought their groundwater was coming from. Lake Superior, Montana, and in southern Minnesota, those are kind of wild ideas, but through public education and awareness programs, we've been able to let folks know that sometimes the recharge area for their aquifers is very close to their own home. And what we do in our own neighborhoods is important for our own drinking water. The more people know, the better. And I think there are so many things that can go wrong, even if the water is deep in the ground, that folks need to test, like they would have their cholesterol level tested or their blood pressure tested.
And it's especially effective to talk to people when they are expecting a new baby.
And I think it's a good time, it's the best time to talk to parents because they are thinking about what's going to be the best for their new baby. And so it is an opportunity to convince them this is the time to have water tested. Maybe you as an adult haven't become ill. Maybe as an adult or as the family, you've been used to the high coliform bacteria and your body has just adapted to it and you don't get sick from it. But a brand new baby coming into the home is going to have a whole different reaction to that water.
The program also involves testing of creeks and streams in the area to assess contamination. Brown, Nicollet, and Cottonwood counties decided to address the problem of private well water quality with an educational program that focused on water testing and reducing water contamination.
What we're finding in this watershed, and there's other watersheds like it, like 7 Mile Creek here, is that there is a groundwater and surface water connection, and that at times of the year, 7 Mile actually contributes to the groundwater aquifer. So if we have high nitrates in our surface waters, that may lead to a possibility of 7 Mile Creek contributing high nitrates to our aquifers in this area.
We think that there's been a steady improvement in the quality of the water, and partly that is based on the public education that has transpired. We have the medical community becoming in the know. We have public health nurses going house to house, and we have extension service and agencies such as public health agencies and environmental health agencies spreading the word on the importance of testing and the importance of protecting the water resource.
Pediatricians and family practice providers really have a role to play in educating families. I think every pregnant woman should be asked the question, if doctors or nurse practitioners don't know where they live, do they have a private water supply? Do they have a well on their farm or a well on their property that supplies water instead of city water or municipal water source?
It would be very effective if on health histories that practitioners take from people as they are diagnosing their problems, if there was a line, what is the source of your drinking water? If private wells are one of the answers, that could be a trigger for the practitioners to put the family in touch with someone who can help them see if drinking water is safe. Many environmental agencies and public health organizations will help families find out what their water quality is so they can make the right choices. Where there are young infants, pregnant women, or vulnerable populations, the tests will often be performed free.
The Tri-County area has taken a proactive approach to preventing waterborne disease outbreaks, and the programs have been especially successful.
There are no federal laws requiring testing of private wells, and services provided by state and local governments may vary widely across the country. Some states require testing wells supplying schools and new homes. Owners should arrange for annual testing for nitrates, bacteria, and other contaminants, keeping in mind that some contaminants may vary seasonally. Lists of state-certified laboratories are available at local health departments and at this website. The vast majority of people in this country can drink water from the tap without fear of harm or illness. But vulnerable patients and people living in an area of known water contamination may need to consider alternatives to tap water. In addition, some people may prefer alternatives to tap water despite increased cost for reasons of taste or persistent concerns about safety. While most consumers think that bottled water is at least as safe as tap water, they need to be aware of potential risks. Because bottled water is considered a commercial food product, it is regulated by the FDA and does not undergo the same testing as water from a treatment facility. Water that is bottled and sold in the same state may not be subject to any federal standards at all. Those with compromised immune systems may want to read bottled water labels to make sure more stringent treatments have been used, such as reverse osmosis, distillation, UV radiation, or filtration by an absolute 1-micron filter. It's also important to consider the shelf life of bottled water and use it quickly to avoid contamination after the bottle is opened. Your patients can check with NSF International to see if the bottled water they are drinking adheres to FDA and international drinking water standards. The International Bottled Water Association can provide information on which brands adhere to more stringent requirements. Another alternative some consumers are using is home treatment, such as filters used at the tap or at the connection between the water main and the connection to the house.
Patients who choose to purchase a home water treatment unit should carefully read its product information to understand whether their filter is designed to remove specific contaminants or just improve taste. Be certain to follow the manufacturer's instructions for operation and maintenance, especially changing the filter on a regular basis. Over time, filters can accumulate contaminants and actually add them to the water when the filter is overloaded. No single unit takes out every kind of drinking water contaminant. Your patient must decide which type best meets his or her needs. For help in picking a unit, contact either of these independent nonprofit organizations. NSF International tests and certifies home water treatment units, and the Water Quality Association classifies units according to the contaminants they remove, as well as listing units that have earned its approval. Underwriters Laboratory also certifies some home water treatment units. Water treatment units certified by these organizations will indicate certification on their packaging and labels.
Communities with acute microbial contamination problems are often advised as an emergency measure to bring water to a rolling boil before drinking it. Some people may choose to boil their drinking water at all times in the belief they are ensuring its safety. Such precautions are not necessary for all but the most severely immunocompromised. In fact, if water is boiled for more than 1 minute, it can concentrate some chemicals like nitrates and lead. A safer, though more expensive alternative for patients with compromised immune systems is a distillation system. Those who receive water from private wells are responsible for having their water tested to make sure it's safe. To have water tested, EPA recommends using a laboratory certified by the state. Check the website on your screen to look up your state certification officer, who can send a list of labs certified to analyze drinking water. For public water systems, the federal government has taken a significant step in consumer education in the area of safe drinking water. As of 1999, it required all utilities to begin sending out a Consumer Confidence Report or Annual Water Quality Report to its customers. This report must include a description of the source of the water, a list of the contaminants found in the water, the levels at which they are found and likely sources, and EPA's standard, any violations of EPA standards in the prior year, and language advising members of potentially susceptible subpopulations to consult their healthcare providers for specific advice on avoiding microbial risk.
Finally, although this program is about drinking water, it is important to note that patients can be exposed to waterborne diseases in ways other than ingestion of drinking water. Vulnerable patients, such as people with AIDS, people undergoing chemotherapy, and recent transplant recipients should be informed that they can be exposed to pathogens through water used for brushing their teeth, making ice cubes, and washing fruits and vegetables. And they should be aware that ice and fountain beverages in commercial establishments may contain unboiled water and therefore pose risks.
Immunocompromised people should also be aware that water in pools, water parks, hot tubs, lakes, rivers, and the ocean might be contaminated with human or animal waste that contains cryptosporidium. This concludes the final section of the program. We have provided materials packaged with the video, including the websites we have mentioned and a list of resources. Remember that to receive continuing education credits, you must complete and submit your assessment and evaluation forms. Instructions are on the website shown on your screen. And thank you for viewing this program. We hope the information is useful to you in helping to recognize, report, treat, and prevent waterborne illness in your community.